I was, already a pretty good revisionist, especially with the nose, which everyone hates doing. And I kind of taught myself how to do revisions. When we were getting the cases in the beginning, it was no, 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 yes, because they were too hard for me. And it ended up going yes, 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 no. So it took my skill set and honed it. So I was blessed to have the opportunity that most people will never get to take your skills to the next level by doing this.
Welcome to the DIEP End. Today's guest is Dr. Paul Nassif, an internationally renowned facial plastic surgeon, celebrated for his expertise in complex revision rhinoplasty and recognized by millions for his work on hit TV shows like Botched and The Real Housewives of Beverly Hills. Dr. Nassif's journey is uniquely American. A business degree from USC, early entrepreneurial ventures, and then a leap into medicine. He completed his medical training and fellowship in facial plastic surgery and then emerged as one of the leading revision rhinoplasty specialists in the world. He literally turned his gift for solving impossible cases into his brand, trusted with faces worldwide. But his career didn't stop in the OR. Dr. Nassif built a medical spa line, appeared regularly on E's Botched, and became a go-to expert in facial aesthetics across global media channels. In today's episode, we'll explore Dr. Nassif's journey from early practice beginnings to media influence, technical innovation, and how he balances compassion and artistry in transformative surgical care. Let's dive in.
Today's a really, really special day. We're joined by Dr. Nassif, really just an exceptional leader in facial plastic surgery and an inspiration to many people, particularly me, and we'll get into that a little bit in the podcast. So welcome to the DIEP End podcast. My name is Saїd, Azoury, and I'm joined by my co-host, Hank Davis. So Dr. Nassif, thanks so much for being with us tonight.
I'd say thank you for having me on board. And I will say, it's funny, sitting here looking at this camera, I'm looking at these two young guys, and I don't, and all of a sudden I'm going, oh my God, I need Botox. And I'm seeing all these darn wrinkles, and I'm seeing you guys don't have one wrinkle at all. Oh my goodness.
It's the camera. Angelo kind of helped us look a little bit more youthful. So.
I probably have a few more after intern year, so.
Oh my God. How funny.
But you've become truly one of the most respected names in facial plastic surgery. I've looked up to you for a really long time, and many of us, you kind of cross specialties by being facial plastic surgery, but the world of plastic surgery in general, and those who are plastic surgery trained, know you and respect your work and respect you. And so one of the questions that we have for our guests, and it's always so much fun to hear about this, is what was your childhood like, and what kind of groomed you into who you are today? And did you always envision this path for yourself?
Great question. I mean, I luckily had a typical, I was born way before you. So in the 60s.
That might not be true.
In 70s, it was a typical where you would actually, my mom and dad and my brother and my sister. My sister was older, so I know that she had gotten married and got out of the house pretty early. But it was the kind of household where you all get up, you all have breakfast. Lebanese household, a little bit loud.
Yeah, very loud.
Very loud. And then the thing for us, which was great, I used to either be able to ride my bike, jog, or take a mini bike, which was illegal, to school. About a good 4 miles away or 3 miles away. I don't know, maybe 2.5 miles away. And after school, you play with all your friends. And when you're young, you can do whatever you want. And it wasn't like you had to be careful or you're going to get, something happen. So it was kind of free spirited. And my mom and my sister always wanted me to become a doctor. So they kind of ingrained that in me as a little kid. And
that also sounds very Lebanese.
Very Lebanese, exactly. And so, the bottom line is now, loving family, I'm actually, kind of where I want to be. So I luckily had a blessed upbringing. Of course, the usual commotion, again, in a Lebanese family, a little bit of the arguing, loud voices, the whole bit. But, a lot of food. Everything was based around a meal, a lot of good Lebanese food.
Yeah. And do you like, so thinking a little bit into your education and experience, what mentors kind of helped guide you further towards your goal of facial plastic surgery? Or what specifically would you say this was the key moment where I said aesthetics was going to be my thing?
I got to go two routes here. Getting in medical school, there was a famous doctor named Dr. Howard House, who was an otologist. And so in our field of otolaryngology, it's a specialist that just works on the ears alone. And he kind of got me dialed and got me interested really in going into ear, nose, and throat. I used to go watch him operate when I was in college. And so that kind of got me excited about doing ENT at an early age. Aesthetics, actually, and by the way, I thought I was going to go into this field, neuro-otology, when I was an otolaryngology resident. But going into aesthetics, facial plastic surgery, didn't happen until I was in, I think, my end of my second year of residency. So it was my third year, third year residency, 1 year, first year internship, 2 years in ENT. And I watched this guy do facelifts and noses and everything. I loved it.
I thought you were going to say you watched Botched.
Yeah, I did. No, I watched Nip Tuck.
Oh yeah, I remember that.
I watched Nip Tuck, and kind of that's a whole story about Botched, in a minute, which I'll get into. So that's what got me excited. And watching this guy do these surgeries, I changed from neurotology to facial plastics. And then there was a little boy who got, unfortunately, bit by a lot of big dogs. And a lot of trauma to his face, neck, shoulders, scalp. And I was on the team to help him. A very young boy. And that kind of also guided me in that direction.
Yeah. And so we talked a little bit about your growing up in a Lebanese American household. What do you think, aside from your family saying becoming a physician is the thing? For me, my decision was either my dad said physician or lawyer, and I became a physician like most of my sisters. But what do you think your cultural background, how did that sort of influence your work ethic, your worldview, and your approach to patient care?
It's funny, is if you're either a Jewish family or a Lebanese family, it's a doctor or lawyer, kind of thing. I think more of the nurturing aspect of the way I was raised made it easier in doing what I'm doing with patients. It blended itself to taking care of patients and being more loving and caring. As a matter of fact, though, what also started is I had an uncle who was a GP, and back then the GPs did surgery. And so I used to go watch him in his office, take care of patients. And I actually, as a little kid, I actually vacuumed and dusted his office. And clean, I wanted to be around there.
Where was that?
I don't think, this was in Burbank, California. Now, I don't think I got paid. I think I had to go clean his office, but I got to watch him see patients. That also drove me to what I'm doing.
Yeah. So, question I have is: so clearly, you had an interest in medicine. You had a great upbringing. Where did you show any signs of the other aspect of your career now, like being in the spotlight or having that that great personality we've all learned to love? Were there signs of that, or was this like a new thing that you didn't know would ever come about?
Yeah, two parts to that. First of all, I'm atypical for getting in med school because I ended up going the business degree background. And back when I was applying, no one had a business degree. So I was pre-med in business. So I wanted to do something a little bit different. So I was in the restaurant business for many years and actually, owned a restaurant back then when I got in medical school.
What kind of restaurant?
Yeah.
It was California cuisine, homemade pastas, fresh fish, pizzas.
Oh, that's awesome.
And, okay, quick deviation, but then we'll get into this question you asked.
Yeah.
So medical school back then, listen, I went to USC. I had fun. I was a business degree. I think I had a 3.75 in business and a 3.5 in pre-med. So I was okay. And the MCAT scores, were very average, no matter if I studied or not studied. I wasn't one of those guys that do great on those type of exams.
Me too. Yeah.
I just said, I had average scores. And the funny thing is, I took it 3 times. First time I studied my butt off, average score. Second time I took these courses, I knew what I was doing. Same score.
I think you're going to say your score dropped.
The Kaplan. Yeah, probably the Kaplan thing. The third time I took it, didn't study one day. Same score. But anyway, going back to that. I applied my first year of medical school. I was on the wait list for a few places. Didn't get in. And I was running a restaurant on Sunset Boulevard in Hollywood where a lot of movie stars would come. I was a manager. And I was also...
That's so cool to think about. It's so cool to think about.
Yeah, I ran a restaurant, and actually on the weekend and the other nights, my friend ran a big club in L.A., one of the hottest clubs, and I was a bouncer. Unfortunately, I was like the smallest bouncer there was. He just took care of me, did me a favor. I wasn't going to do anything.
We're not going to ask any questions about you being a bouncer.
Yeah, that was funny. I acted like a big shot, but the reason why I acted like a big shot and, would kick people out and stuff, because if I had any issues, I'd always have 3 or 4 gigantic guys behind me that were helping. So, I felt confident, obviously. And then second year, I applied, did a little more volunteer work, did a little research, whatever, and got a few interviews again. Don't hear anything in the normal period of time. In the meantime, talking to my family, I go, you know what? I might just go in the restaurant business. And there was a restaurant in Pasadena, California, where the Rose Bowl is. And I ended up opening a restaurant and getting it all ready. We got a great price on it. And I was working, getting it set up, hiring everyone. The day I opened the restaurant...
How did your parents respond to you when you said that?
Well, they knew I was good at it. I mean, I've been working in the restaurant business, doing something or another for probably 10 years before that. Or maybe not 10 years, I was a kid, but maybe about 6 years. So I was working in restaurants. And first day I opened up, the place is packed because it was a brand new restaurant. We didn't have a soft opening because I didn't know what a soft opening was. Where you test the kitchen out and you invite your friends in for free, when everyone just kind of eats. Didn't do that. Open the doors were packed. The kitchen's backed up. People are waiting a long time. Place is packed. This was 1987. And I get a call from one of the schools, hi, you got in, possibly someone dropped out. School starts in 1 week. An hour later, I got another call. Swear to God. Same day.
The
Packed
timing.
restaurant. And I go, same thing. Got a med school. Starts in 10 days. I go, hey, would you guys mind if I call you back? I'm kind of in the middle of a restaurant thing. And I was excited. So I called both schools back and I asked both schools which one would, one in Wisconsin, one in Chicago, hold the year because I just opened a restaurant.
Yeah.
So I don't have to apply again. The one in Chicago says we will, but you have to sign a contract saying you're not going to apply anywhere else. I did. Worked in the restaurant 18 hours a day, 6 to 7 days a week.
Yeah.
Worked my butt off, which prepped me for med school.
For med
school.
I was going to say that brings up a common theme is, first of all, the grit that requires, things that the MCAT doesn't teach or test. And also, now I'm seeing it more than ever as a resident, the way you interact with patients and make them feel welcome. I mean, the restaurant business and that scene is the best place to interact with your customers. And that you probably brought all that with you on TV, in the hospital, in the patient's room. So I think those things shouldn't be overlooked. I think they all made you, what you've become. But that does, beg the question, how Botched came along, if you want to tell us.
So anyway, then I got a medical school and then
that
was it. And but I will tell you one thing: working 18 hours a day, going into med school, working all day, you know, whatever you do, and then you study after school for a little bit, and then you go work out with your buddies, and then you go have a bite to eat, and then you go back and study. I was used to it. I was used to working my butt off, so that helped me get, you know, number 1 or 2 in the class, whatever it was.
Can I just tell you how cool a podcast is? We don't hear Dr. Nassif talk at a national conference, or maybe we do, but we don't hear you tell this story. And this is such a cool story. It really is.
Yeah, I've given this before because I do lecture everywhere.
I thought you were saving it just for this podcast.
But I haven't given that story. What I just gave you. I give the story of Botched, but not the story I just told you. And
that's a tough decision. I'm thinking about the position you were in. That's not an easy one.
Which part?
It was just the restaurant being successful, you being good at it,
and having to pivot.
Yeah, but I wanted to because I said I want to be in medicine. So my sister came in and took over. And that's a whole nother story. But
that's for part 2.
Well, we'll just say, you know.
Good for your sister.
But, yeah. So getting in to medicine when I became a facial plastic after I go to LA and I have a partner who's already been doing derm. So a dermatologist and I hook up together, build an office, build a little surgery center based on all loans, personal guarantees from the families. Every day for a good year, we're looking at the bank, seeing how bad we are in the, in the red.
Oh, that's stressful.
And we're opening up in the heart of Beverly Hills where there's a lot of doctors. And then I pick a field which no one else was doing then, the hardest of all. And I taught myself how to do it after my fellowship was revision rhinoplasty.
Oh, that's so awesome. Mabruk.
Baby Paul.
Oh, that's so sweet.
Look at all that hair.
So cute.
It's about 4 months. How old is he? 4 months?
That's so cute.
Here, you want to just shove your head in here?
He's big. Brittany. Hey, how are you, Brittany?
That's my wife. She's the Greek one.
Your baby's
nice to meet you.
How do you get the name?
Paul Jr.? No. I got a Paulina and a Paul. Bye, babe.
I love
I got a Paulina and a Paul Jr.
Oh, that's so awesome.
So anyway, going back to what we were saying, I went and did, they started doing these makeovers back then, like on Extra and ET and all these things back then. They might not even be on there anymore. Like, do a makeover on a patient. And so I started pitching myself and hired a publicist. And I started doing those. And then that Dr. 90210 came out on E! And I wasn't one of the first ones. I think I was on season 3 or something for 1 year. They kind of didn't want me anymore because I didn't want my kids getting involved on it. Then we got on Housewives of Beverly Hills, brand new. My wife and I, ex-wife this time, Lebanese girl, Adrian. And we did that for 3 years. It lasted 3 years, and that we ended up getting off, and we ended up getting divorced. Maybe not the best thing, but that show guided me to sitting in a restaurant with the producers of the not Botched, but the Housewives of Beverly Hills in Orange County, talking about, hey, you guys want to do something? Let's do something medical. I go, let's do something where we're actually fixing people with really bad plastic surgery and show what happens. We discuss it. And then I called DeBro, who was just on I forgot what show, some makeover show. And he was a goofball. And
how'd you know him at the time? Just randomly?
Because my mom and my sister met him. Uh-huh. And then he actually practiced in my office for a little bit, like 1 day a week, coming up from Orange County. And I called him because he was just on The Swan, I think. Or Bridezilla, some weird thing. I don't know. Bride something. And horrible show. That one was. I called him, and I think he was just getting, he wasn't on Housewives of Orange County yet. I don't know. I go, hey, you want to do this show? And I explained to him, and he goes, that's the stupidest idea I've ever heard, that you want to fix plastic surgery gone wrong. But what about when it's destroyed? And what about when we have a complication? I go, so what? So what, how it's real. So what we do in the office. So everything. So we did a little sizzle reel. They filmed us just talking, looking at photos. And E didn't pick it up as a pilot. They picked it up as a whole series immediately.
Oh my God.
And then
That's
we
so
trended
cool.
on Twitter when it opened up. And, we did 8 seasons, one more season. So 9 seasons total, because it was Botched by Nature. The original title of it, the working title was Nipped, like nip tuck.
Like nip tuck. Yeah.
Nipped. Nip with another word instead of tucked. Switch the first word to an F.
Oh,
But that was what it was called.
That's hilarious.
But of course, you can't use that. But then E came up with the word botched. And that's how that started.
Yeah, and obviously it gives viewers, like just like you said, you want to show them how it's real. It gives viewers a rare behind-the-scene look at our world of reconstructive plastic surgery. Doing this show for so long and seeing the spectrum of patients that come in, is it something you already knew and just wanted to share with the world, or what changed in your perspective on the profession, if anything?
You mean doing that?
Yeah, just like from being on the show and just from being on the show.
It did everything. I mean, it did so much. First of all, what did it do? I was already a pretty good revisionist, especially with the nose, which everyone hates doing. And I kind of taught myself how to do revisions. And in the beginning, when we would get some of the
revisions,
but when we were getting the cases in the beginning, and I think our first year we had the casting department got 500 people for us to look at. It was no, yes, because they were too hard for me. And so what it did, it took my technical skills, because after the years, it went from 5,000 people applying, and it ended up going, yes, no. So it took my skill set and honed it. So I was blessed to have the opportunity that most people will never get, to take your skills to the next level by doing this. 2, I should say 1, really, more importantly, we were able to help people that didn't have the wherewithal financially, or knew that they can be fixed across the country or globally. And we were able to help people. 3, or maybe 2, we're able to teach people and warn them of what not to do.
Yeah.
Don't do this, don't. Now, most of them didn't listen to us, the ones that you saw on the show. Bigger this, bigger that, whatever it was. Overdo or makes us smaller. We're able to educate of what not to do.
Yeah.
And then, then of course the thing is it builds you a global reputation.
I was going to say, you have to have really thick skin, because it really puts your work and you under a microscope. That must have been, even though you were on TV before, this took it to another level. How did you deal with that? Was that difficult to deal with?
Yeah, the cameras don't ran you, all the time when you're filming. Whether you're doing the interviews and consults or actually in the operating room when they're filming, everything.
And you can't hide your patient outcomes.
You can't. No, you can't. It was, when I look at these, some of them were good outcomes, some were average. A few, a good amount, we had to go back, didn't heal well, needed revisions. And we show all that. You didn't heal well, you got an infection, you have ischemia, you got this problem, that problem, here's why. And then me, with my personality, I'm kind of big charge, tough love kind of thing. And so I'm a little strict on patients in the beginning, so they understand what they're getting into.
Yeah.
So it wasn't that hard for me for being filmed.
Yeah. Is there any particular patient or episode that sticks out that's the most memorable to you?
Well, there's 2, I think, that made the biggest impacts on these patients' lives. There was a lot of, I can name 30, 40 of them, if I had to. but there was two. There was one lady who had, rhinorrhea, discharge from the nose, clear fluid one side. And so obviously and she had trauma before, and we're thinking that she has a CSF leak. Now, is this more for doctors or for the general public?
Everyone.
Okay. So, CSF is fluid around the brain.
Yeah.
Spinal cord. And so we did I ordered a CT scan, even though it probably was just postnasal drip, but I got to be very sure. And, an incidental finding was some brain aneurysms, which were getting a little lengthy or big, I should say, to the point where you don't watch them. And back then, I don't know if they were doing a lot of the endovascular, radiologic, stenting or coiling. They do now, but that led her to having open surgery. I think it was open, or maybe it was a stent, and it fixed her. So it saved her life, because if one of these darn things, an aneurysm pops, you got a problem. And then I ended up fixing her nose. And the thing was, she never went outside and did things with her daughter who had severe autism because she couldn't stand the way her nose looked. And it bothered her so much that she didn't even go to the park with her daughter. So when I fixed her, she was able to go outside and be with her daughter. It made her daughter very happy. And the last episode of the series, a lady had a gigantic benign tumor on her face, hanging down this big all the way to here, neurofibroma. And we did pretty incredible surgery on her. She had some complications, some necrosis of the skin, but she healed beautifully of taking this huge tumor hanging from her face. She was from Mexico City. No social life, no lover, no nothing. After, her life changed. Boyfriend, job, the whole bit.
Yeah, the confidence is incredible.
That's transformational, because you see her walking down the street, people are going, "Oh my God, what is that?" And screaming or crying, kids. It was horrible, like a monster.
It's funny. I think back to what you were saying about your relationship with Terry Dubrow, even before all of this, and how he used to work out of your office. How did you guys kind of sort out disagreements amongst each other when it came to patient care?
Well, we were pretty in tune for patient care. In other words, I take care of my patients and he takes care of his patients. However, if I need his advice on something or he needs my advice, we're going to ask it. Now, we may listen, we may not listen. Did we argue about other things? Yeah, we did. But we're, guys can argue, call each other a few names, do whatever. But then in the next 20 minutes, let's go have a bite to eat. So we argued. Or if he kind of went over the line or kind of overdid it to me, the insults and all that. If it usually it just kind of rides off my, it's funny. I didn't care, but if he overdid it, then
you got Lebanese.
You let him know.
You can tell I was upset, but obviously off camera, we would go at it.
Yeah.
But again, we're friends.
Is he a good hernia surgeon?
Hey, that's right. He did my hernia.
Yeah.
Yeah. He did it endoscopically.
Wow.
Through my little belly button there. It was umbilical hernia, but he also tightened up, my little bit of a diastasis and through a scope. So gotta give him credit. Did a good job there.
Yeah.
Excellent.
So we talked a lot about like the difficulties of revision surgery kind of being in the spotlight with Botched. What advice would you offer patients who are seeking like these, basically, like you said, lived in a shelter their whole life, have horrible issues that they want to have addressed and need really complicated revision surgery? And just as an aside, we all know how healthcare is, and it's actually, patients don't know who the good technical surgeons are. Now our world is filled with social media. Everyone kind of self-applauds themselves, self-promotes. patients don't know who the good technical surgeon is who can save them or fix their noses. So what advice do you have for patients who really need like complex revision surgery? Where do they go?
I mean,
You
listen,
get
you
what
can
I'm
find
saying,
anything
right?
on the internet right now.
Yeah.
I mean, you can find out. I mean, you could even, yeah, you can even ask your chat
GPT, it's amazing.
GPT, who's the best breast revision expert. And, you can find anything on the internet. And so I think the easiest way to do is start with the internet, one way or the other. Phone in on the doctor's credentials, her credentials, reviews, everything else.
Yeah.
So I feel that you can get all that. When we were starting the show, it just wasn't that easily available. Or some people from different parts of the country didn't even know there was a fixer-upper for that problem. So a lot of people didn't know. So I think the best thing to do is do your research, find the doctors, and then do your research on their training, their expertise, lawsuits, accolades, all that.
Yeah.
Research, experience.
Yeah. That's important because on social media, oftentimes, everyone looks like a star.
Social media, listen, we're all doing it in regards to, especially in the field of aesthetic surgery.
You have to do it.
You're all putting up befores and afters.
Yeah.
And that is the best way to get to a gigantic population of people, assuming you already have a good presence. Otherwise, no one's going to find you or see you.
Mm-hmm.
Then you have to use these other systems to kind of get your, name exposed out there.
Yeah. So kind of, skipping ahead and thinking more about, how trends in facial plastic surgery in general, what biggest changes or innovations would you say that you're most excited about? And I know that, you launched a med spa, skincare products, et cetera, but kind of within your entire field of facial plastic surgery and aesthetic surgery, what would you say you're most excited about?
Well, I'm going to talk about some of the newer techniques in neck surgery called deep neck surgery. And, working with my Brazilian colleagues and stuff, even at my age, I'm constantly pivoting and learning, and I'm not doing the same thing. So to me, what I'm excited about is the newer techniques in the neck and some of the biologic adhesives, things called hemostatic nets, from the surgical standpoint. I feel that our field still in the art of healing fast, preventing, collections of blood or fluid, or not great, tissue healing. I think that there'll be better ways to treat that with these different techniques and different procedures. So I think that's still evolving, and compared to, the non-invasives. One thing I'm seeing, and when I'm in a WhatsApp chat with about 70 different world facial plastic surgeons, world famous or renowned in our group. Fillers. If you put fillers here, we're finding it now like here. It's traveling. So the thing I'm going to say is we just got to be a little bit more careful of fillers. And it's when we do that because we're finding it and it's causing scar tissue. But I will tell you something though, that from the skincare side now, which I started maybe 8 years ago, I noticed that if I prep the skin, one cleansing that palate, exfoliating, detoxifying, and also delivering incredible antioxidants and hydrators to the skin pre-surgery. It makes, your it makes that palette where you're going to paint on so much better, improved. And so I think it just makes your results better when you have excellent treated skin. Makes your results feel better, look better, and adds hydration to very dehydrated skin, which makes the dissection, for example, a lot easier.
Is that what led you to launch your skincare line?
Yeah, because years ago, maybe 10 years ago, I had a few products that I just used for my own patients, but that we came up with. And then I started saying, why don't I do this to the masses?
Yeah.
And then I had that launching platform of using Botched.
Yeah.
Yeah. And obviously, it was a massively successful show. You had, I think, 8 seasons. So there was a big change in the atmosphere of facial plastic surgery from when you started to when you ended. Did you notice any different trends in, with social media now becoming more mainstream and unrealistic goals? How did you, manage patients who came in here with all those filters on and wanted to look just like that?
Yeah, the filter dysmorphia, we call it. They come in and say, here's what I want. Sometimes they make their skin look perfect. What's good about that is they went on a mission to fix their skin, whether it's with small lasers, Botox, good skincare, versus the ones that are overdoing the nose or the lips. We would have to educate and say, we're not doing that and don't do that. And here's the reason why. And then we show them 5 horrible results or something and talk about the risk and the danger of obstructing a blood vessel, which you don't know if you're going to do it. It can just happen. And then you have, horrible problems with that. And a lot of the newer technology in the spas was some of these lasers that are lifting, tightening, and firming the skin inside and out. I think that is something I love because you're starting early. But just know that when you're doing all these lasers and these micro needling, with any of these, so we say, taking care of your skin is great, but micro needling with radio frequencies, some of these other things. The thing again that we're finding now, besides the filler stuff, is we're finding out that those treatments are now causing deep scar when we go and do a deep plane facelift. So there's some great technology, but at the same point, I'm now almost saying I'm not going to do A, B, and C. And here's the reason why.
Yeah.
Because of all the possible scar formation that could occur and everything else and the risk to damaging the skin. So I think that tightening the skin, more innovations like that without doing deep damage is something that's going to hopefully evolve.
Yeah. I think, hearing about you saying this, reminds me of my mom. My mom is ageless and beautiful. And seeing her growing up, she had 10 different creams that she would use in the mornings, the evenings, at night before she goes to bed. Literally, sometimes you wouldn't recognize her. But it worked. I mean, it's unbelievable. This might be a loaded question, but if you had to give a few recommendations to somebody about, okay, this is what I recommend for you to do from a skincare products or when to start with laser, whatever, what would be your recommendations?
Always take care of your skin starting from a young age.
What's
One.
a young age?
You can be a teenager. My kids are using
Paul
my products
Jr.
even,
has already got cream.
Yeah. Paul maybe a little bit young, but the teenagers. Exfoliate, cleanse, and hydrate. Starting off early for your skin. And then using good antioxidants and good retinols, vitamin C's. That's to the basic of everything. So I think as a tidbit of advice to give to everyone, you do that. If someone's going to have surgery, I'm a huge fan of hyperbaric oxygen, for example. and I want all my patients to get into the chamber before and after surgery. And, I think the other thing is, IV therapy. As long as it's carefully administered, IV therapy, following a procedure, some Tylenol and some different vitamins and all that, the patients feel a heck of a lot better following surgery. I mean, that's just a few things. I can name 20 different things to get someone prep for surgery.
Yeah, and the retinol, I remember that since I was a kid. But okay, so now I have sort of a few. We're getting into towards the tail end of this interview, but I wanted to ask you a few things about advice and reflections. Clearly, a lot of us look up to you as a technician, as a person, and now as a dad. What advice would you give to aspiring young surgeons who want to specialize and do something that you're doing? What advice? I mean, clearly you gave us plenty of advice by the MCATs, not being discouraged and trying again. But what advice would you have to share?
Well, in regards to learning how to be a facial plastic surgeon or plastic surgeon, you have to work hard. You have to become very OCD. You have to become type A if you're going to do a great job. And you can't complain about, I need more of a work-life balance that hopefully I won't get in trouble for this.
No.
But for that first year, you got to dedicate. Your goal is to say, what can I absorb in my head? So you need to be able to work your behind off and watch, numerous doctors, numerous surgeries, and work and take whatever it takes to work really, really hard. I mean, this is for the newbies coming in. And obviously, work hard. Always do the right thing. Don't do any shortcuts. If you do a shortcut, it's going to always come back and bite you in behind.
Mm-hmm.
And the last part about that, just be a good person. And putting all these together, being a good person, that's still going to come off even as you're applying for interviews or whatever it is. I'm doing interviews right now for my fellowship, for example. And with me doing my interviews, I think I'm interviewing 31 or 32 fellows for a spot. And they all say, we want to work hard. We want to absorb as much as we can during that year and jump 5 years ahead. And I'm looking at, they're all qualified. Which of these do I feel is a good, kind-hearted person?
Yeah. So how does that come across?
That's just tough. Life experience of me.
Yeah.
Using my gut feeling.
It's from working in the restaurant, from dealing with people. Seriously, like being in the restaurant business and dealing with all that kind of stuff.
Yeah, I mean, but for me, it is, my gut, and my gut, at my age, usually is pretty good.
Yeah. So if you were to look back now and say to yourself, looking back on my career, my training, restaurant business, getting in medical school, Botched, Housewives, is there any part that you would say, this is something I deeply regret, and I wish that I could pass along this advice to somebody else? I feel like I can name a bunch of myself, but I'm just curious from what you told us.
In the past, I probably would say there's many things I probably won't want to erase. But if you look at them, those things that weren't that great, and maybe for all of you listening, have led you on to either one, learning a lesson, or taking you to the next step in your life. So if I didn't have this bad thing happen, like my divorce was horrible, because we're in the public, we're celebrities. Horrible thing. And accusations
that's
thrown
the
out and
downside.
everything.
That's the downside of the TV.
Oh, it sure is. A downside.
I'm
and then
sorry
everyone knows. And so I'm in the media every week. I was in the media.
Yeah.
I'm sorry
with TMZ and stuff like that. But so I would say that if I look at almost, and maybe I forgot, of something I did that had not great ramifications or just bad luck, I would not want to change any of the things, the bad things that happened, because what it did is it took me to the next level. It taught me something, made me meet someone, changed my life. For example, getting divorced. If I didn't do that show, possibly helping me get divorced, I wouldn't have met Brittany, and they have two beautiful children and a wonderful wife.
Yeah.
And so I'm extremely happy.
Yeah.
So I'm going to tell everyone, you're going to learn anytime you do something that maybe doesn't come out right. You always have to take the positive out of this. What did this teach me?
Mm-hmm.
What can I not do again? Of course, there's going to be things you just want to erase from your life.
Yeah.
Yeah. And I think that's a common theme. A lot of, our guests that we've had on, and this is what makes it so special, is, the greats like you, they come on and share, a letdown or, things that they've had to gone through that made them better. And I think that's a superpower that you guys all have, is taking these shortcomings and spinning it into a positive, and it's better off that it happened that way. And a lot of people need to learn to see it that way and execute like that.
Well said, Hank. You did a great job saying that.
I have to ask one question before we go into the rapid fire last few questions. Have you ever thought about opening a restaurant now? I feel like now would be the perfect time.
Yeah, call it Botched.
To be honest with you, don't even call it, like, I think about it. I don't know if it's a Lebanese thing or not, but that's like my number one goal when I get to one point. I want to open up a restaurant. My mom's going to be the cook or like the director.
Saïd, I think that's why we go well together, because I'm
the
Jewish
director
and you're Lebanese, so we have the same thing going.
But you have to open a restaurant. This like
remember the Lebanese are the Jews of the Arab world.
Yeah, but have you thought about opening one?
I'm already I'm in the restaurant business.
Oh, you are? Okay.
So we have one with in Vegas and Huntington Beach. It's called Fletcher. It's with Mark Wahlberg, Mexican cuisine. So we're part of that. And then in Vegas, we have more Mexican restaurants and dessert and a few bars. So I'm involved. I'm a partner in the food business still involved.
Oh, that's so great. That's so
cool. Involved.
Okay. Well, in the interest of your time, we'll ask these last few questions.
We just have some last fun ones.
How do you want me to answer them, though? Is it when you say rapid fire, you just want a quick response, or what do you want?
No,
this is just to respect your time. You say whatever you want.
Right, go for it.
So just what's your favorite procedure to perform?
Now,
since
it's always been nose and revision rhinoplasty, but now my new favorite is called deep neck surgery. We're removing submandibular glands and rejuvenating the neck. It's hard and scary, but I love it.
That's awesome.
Or I should say a little risky.
You know what? Yeah. You know what I'm thinking of? I know this is a rapid fire thing, but I'm going to interject a little bit. You know what's tough about being in your position is if you ever needed when you're like a leader and you're an expert in the field and you ever need surgery yourself, I don't even know who I would go to. Is that like a common thing when you get to that level where you're like an expert? Do you just want to operate on yourself if you ever, God forbid, needed surgery?
Yeah, no, because I got to tell you, there's plenty of great doctors that do great work. I mean, a lot of my friends, especially when it comes to the lower neck and face, incredible surgeons.
Yeah.
So I'm blessed that I know plenty of good people.
Yeah.
Yeah. Something else we like to learn from our guests, and I guess we left it till now, but just what's your outside of work life like? What do you like to do for fun? How often do you work out? How much do you sleep every night? Just kind of your process and your habits.
I'm trying to play 18 holes of golf a week now. I love golf.
Did you always learn how to play golf? Did you always?
No, I sucked. I still kind of suck. My wife now is kind of she played 9 today. She's getting into it. Going to play on Saturday with her. And so golf, Love it. It takes your mind, all your stress. Well, you get stressed out, you know, when you screw up hitting a ball, but your mind, you get into another world and everything else is gone. Hanging out with the kids, obviously. Paulina right now, the 4-year-old, is at, I think she's actually, if I'm not mistaken, she's right now at a golf lesson, and she's too young. She's like really young. I'm
thinking about my 4-year-old trying to hold a golf club, but that doesn't sound
Hey,
like it's
you
possible.
start 'em early.
She tries, a little small one. She can't really lift it up and swing back. Working out, I try to work out about a good 4 or 5 days a week, and I work out hard. Like, I live in Orange County, California, and I practice Monday through Wednesday in Beverly Hills, Thursday and Friday in Orange County. So I'm getting picked up at 4:25 a.m. Monday,
Oof.
Tuesday, and Wednesday.
Wow.
I try to sleep a little bit, but I can't. I get dropped off at the gym, and I work out with 4 guys that are crazy and young. We work out for about an hour and 45 minutes at least. Then shower, go to work
That is
3 days
ridiculous.
a week. And then I
That's
get
awesome.
home late because it's a 2-hour drive back home.
So what time do you go to bed with a day like that?
Because I try to get at least 7 hours of sleep. I'm in bed by around 8 o'clock.
Uh-huh.
Probably not falling asleep till 9.
What is the strangest patient request that you've ever received?
By the way, I have 5 kids, so that also keeps me busy.
Yeah.
Our strangest request was to make someone's ears look like an elf.
Mm-hmm.
I remember that one.
You know,
I
or
remember that one too.
put some weird implant in someone's forehead. I forgot what the heck it was. They were doing the donut implants or some weird thing. It was something they were doing in Korea. I don't know. It was very weird.
And you said no pretty quickly, or
Yeah,
Oh, yeah.
that was declined.
Yeah, we say no all the time.
See, Saïd, you actually did that yesterday, right? How did that
Yeah,
turn
exactly.
out? Okay, what's your favorite surgical instrument?
Hold on, I'm thinking.
Yeah.
There's a little dissector, and when you're doing facelifts, and there's so many different names to them, that it's a blunt little dissector and opens up the tissue. And called a little duckbill. That's the simplest word for it. And I love that instrument because it can dissect tissue without damaging any of the nerves.
Yeah.
Wow.
Trepset's one of the words. I mean, I don't know. There's all different kinds.
Yeah. I have one more question, and thank you, Dr. Nassif. This has been incredible. Our guests are going to love it. I know I did. We learned so much from you, so thank you for taking the time out of your busy schedule.
Sure, Hank.
But what kind of music do you listen to in the OR?
Ooh. That changes daily.
Yeah.
Right now,
your request or the OR staff request?
it's me. I'm putting the music on. It's either John Summit Radio. You guys know who John Summit is?
Yeah. I
Yeah.
saw him live in Vegas, actually.
Oh, you did, man. I'd like to see you.
Yeah.
John Summit or Pearl Jam or Nickelback Radio or Creed Radio or sometimes some very old school rap,
Mm-hmm.
like Chronic by Dr. Dre, that kind of music.
Yeah.
Awesome.
So pretty, no, not really, if it gets tense, there's no music, but not really. I don't listen to, I'm not listening to classical in the room or massage music. I'm not doing that.
Yeah.
I need something that's going to keep me, boom, keep me going.
Yeah. It's funny. It's so fun to hear what everyone listens to in the OR, and most people listen to something. I know some people don't like to listen to anything, but I can tell you this, Dr. Nassif. I mean, everything that I thought of you, I can't thank you enough. I mean, this is like so inspirational, but just so much fun, most importantly. And like Hank and I said, it's been so great to talk to people like you, just to that we don't get to hear from at conferences. And I think that's the biggest impetus. Typically we're like doing it with academic plastic surgeons, facial plastic surgeons. We branched out into CEOs, CMOs of major medical centers. So it's been a lot of fun. So thanks so much for your pearls of wisdom and your time. I really appreciate it. And congrats on your newborn and your beautiful family.
Thank you so much.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.